Which is the serum protein synthesized in the liver and help to maintain osmotic balance? Option A, albumin. Option B, globulin. Option C, fibrinogen. Option D, immunoglobulin. Answer is option A, albumin. Major storage form of lipid is option A, phospholipids. Option B, cholesterol. Option C, triglycerides. Option D, phosphatidylcholine. Answer is option C, triglycerides. Breakdown products of nucleic acids. Option A, urea. Option B, creatinine. Option C, creatine. Option D, uric acid. Answer is option D, uric acid. A cloudy appearance of serum due to excess lipid content is called option A, chyleuria. Option B, lipemic. Option C, icteric. Option D, hemolyzed. Answer is option B, lipemic. Elevated levels of dash increases the risk of coronary artery disease. Option A, protein. Option B, creatinine. Option C, cholesterol. Option D, calcium. Answer is option C, cholesterol. Normal levels of serum triglycerides is dash. Option A, 10 to 100 mg per dl. Option B, 10 to 190 mg per dl. Option C, 100 to 500 mg per dl. Option D, 600 to 800 mg per dl. Answer is option B, 10 to 190 mg per dl. In vacuum collection tubes, which is the color of stopper for glucose determination? Option A, gray. Option B, light blue. Option C, red. Option D, lavender. Answer is option A, gray. Physiological saline is option A, 8.5 percentage. Option B, 0.85 mg percentage. Option C, 0.85 percentage. Option D, 8.5 mg percentage. Answer is option B, 0.85 mg percentage. Dash is the enzyme in enzymatic method of glucose that converts glucose to gluconic acid. Option A, glucose peroxidase. Option B, glucose oxidase. Option C, glucose dehydrogenase. Option D, hexokinase. Answer is option B, glucose oxidase. Which is the enzyme in glucose analytical methods that converts glucose to gluconolactone? Option A, glucose peroxidase. Option B, glucose oxidase. Option C, glucose dehydrogenase. Option D, hexokinase. Answer is option C, glucose dehydrogenase. Name the enzyme used in enzymatic methods of glucose that converts glucose to glucose 6-phosphate. Option A, glucose peroxidase. Option B, glucose oxidase. Option C, glucose dehydrogenase. Option D, hexokinase. Answer is option D, hexokinase. A pancreatic hormone which increases blood glucose concentration. Option A, insulin. Option B, glucagon. Option C, adrenaline. Option D, adrenocorticotropic hormone. Answer is option B, glucagon. Normal renal threshold for glucose. Option A, 100 to 150 mg per dl. Option B, 80 to 120 mg per dl. Option C, 160 to 180 mg per dl. Option D, 180 to 220 mg per dl. Answer is option C, 160 to 180 mg per dl. Find the odd man out. Option A, glucose oxidase. Option B, hexokinase. Option C, orthotoluidine. Option D, glucose dehydrogenase. Answer is option C, orthotoluidine. Find the odd man out. Option A, hexokinase. Option B, Folin-View method. Option C, orthotoluidine method. Option D, Nelson-Somogyi method. Answer is option A, hexokinase. Name the enzyme in enzymatic method which converts hydrogen peroxide to water and oxygen. Option A, hexokinase. Option B, peroxidase. Option C, aldolase. Option D, pyruvate kinase. Answer is option B, peroxidase. Which is the storage form of glucose? Option A, pyruvate. Option B, lactate. Option C, glycogen. Option D, insulin. Answer is option C, glycogen. Which electrolyte is most important in pH balance? Option A, sodium. Option B, potassium. Option C, chloride. Option D, bicarbonate. Answer is option D, bicarbonate. Which of the following is not a protein precipitant? Option A, tungstic acid. Option B, trichloroacetic acid. Option C, methanol. Option D, acetic acid acetic anhydride. Option D, none of the above. Answer is option E, none of the above. Glycogen is stored in option A, muscle. Option B, liver. Option C, kidney. Option D, adipose tissue. Answer is option B, liver.